Welcome to the Body Harmonics Podcast, where we move freely, heal deeply, and flow with ease. I'm your host, Renee McLaughlin, somatic educator and the creator of Body Harmonics. For over 30 years, I've guided people like you out of pain and limitation and back into your body's innate wisdom. Are you ready to awaken your life? Let's dive in. And in this episode of the Body Harmonics Podcast, I am here with one of my absolute besties, Dr. Kym Caporale. Hey, Kym, it is so nice to see you on here today.
Hi, Renee. It's nice to be here. Thank you.
You are so welcome. And let me just give a quick introduction to my dear friend, Dr. Kym Caporale. So Kym actually is are you guys ready for this? She is a doctor of oriental medicine and acupuncture. And actually, she tells me that her PhD is also in health research and design. How impressive is that? And before that, Kym was a speech pathologist. So Kym has had an acupuncture and health clinic, I'll call it, in St. Petersburg, Florida for over 26 years. And she specializes in helping people with fertility issues, with respiratory issues, but really Kym is just there to help people improve their health and has done just absolutely amazing things. And interestingly, a few months ago, I was having some health issues in a diagnosis. And I looked at that and I immediately went, okay, now wait a second. I'm not going to take this referral to this big medical specialist until I talk to Kym, because it doesn't feel right. I immediately, who's my first call? My first call is to Dr. Kym, who says, just get your butt down here. I hear that. Just get your butt down here. Of which I did. And poor me, I had to go to St. Petersburg, Florida. And Kym just started to do some tracking on me and some acupuncture. And I am feeling great now. Thank you so much. So welcome, Kym. Welcome.
Thank you.
But today we are going to be talking about a new technology called Super Patch. And so for that, absolutely, and I have my whole package of them because I got introduced to the Super Patch from Kym. And so that's what we're going to be talking today about, this amazing new technology. So Kym, I'm just going to let you take it away. Tell me about the patch. How did you find out about it? And let's talk patch.
Okay. Well, it's been a journey, but a very welcomed journey, a place where I've always wanted to be in my practice. And who knew that these little patches that are 100% ingredient-free patch uses your skin's neuro-receptors to send a clear message to your brain, reconnecting your body's natural functions, all these things. Who knew that I was just going to find it? And I actually had a call from a friend and a patient that had 2 neurodivergent children. And she said, Kym, I found these super patches. Somebody brought them to me and I decided to try them on the kids, but what do you know about them? And I said, I do not know, because I was using, and still do, another great patch. And so I looked into it, but I took a deep dive into it and ordered some, and I got them. And then I started trying them on my friends, my patients, my family, myself. And oh my gosh, it rocked my world. They were so amazing. And I just was blown away. And now I find myself in a position where I'm talking to other healthcare practitioners, more natural healthcare practitioners, but I'll say Western and Eastern, and building a team of acupuncturists to actually use just like the needle, and how wonderful, and they work just like the needle. And who would know that years and years and years ago, when I renamed my business Beyond the Needle, that I would be such a wearable wellness junkie, which that's what I am, a wearable wellness junkie. You know that. We've gone through it time and time again, and we
Yes,
just
we
believe
have
in
the
it, right?
blower. We were using the terahertz health blower on the points, which works
Right.
beautifully as well.
Exactly.
Absolutely.
Exactly. From a watch to, I mean, right? To some other technology. You and I have always played with that since we've known each other. But these patches have astounded a lot of practitioners of traditional Chinese medicine. I don't think they really, until I sent them some and introduced them to the technology, did they really believe it. And now they're using it on patients. I know when I use it on a patient that I'm still doing acupuncture on, it holds the treatment. And I'm sure that even in chiropractic care, it would hold a treatment. So, oh my gosh, and the science behind it, the research that I'm able to present to medical professionals and people that are here, um, they are blown away. This was developed over 15 years ago, um, and it's multiple, I think, lots of double-blind studies, third-party clinical studies, FDA-registered medical device as a medical device, the manufactured by 3M, covered by your home health savings plan. I mean, well, how could it go wrong, right? You can't say that about everything that's out there for wearable wellness. And the patch is touch therapy, simple, tactile therapy, sending a message to your brain.
Right, exactly. And now, one of the things that I find is there is a saying that I just love, and that is that simplicity is the highest form of sophistication. And I know that that's how you treat
Mhm.
when you are using needles and doing acupuncture, but really for everything. For you, it's like how little can you use to get the most amount of benefit out of it. And I know that as you and I have talked in the past, you are really saying, I just feel like so many healthcare practitioners, I'll use acupuncturists, over needle, they over treat, and you just don't need to do it. And, I know one of my other kind of energy mentors, Lauren Swenson, it's kind of like, if somebody is yelling in your face like this, what do? We move back. But if somebody's whispering, what happens? We move forward to listen. And so let's just whisper the information to the body and allow the body to heal itself. So once again, the patches they are giving the body the information that the body needs to shift, to create coherence in the body. And I love that idea of it.
Right.
And and I think, again, sometimes, even though we all say, oh, simple is best, we go, simple is best, but now I need all the information. I want to know all the science. This doesn't make sense. I don't get it. My brain needs to understand. And so, a lot of times, especially us more Westerny thinking people, we want to know all the details. And this is one technology that there are details if you choose to dig down in. And I think that's what you were saying. There are
Oh, yeah.
all kinds of studies
Yeah.
showing this technology does work.
Yes. 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 Sometimes we're such a microwave society. We want to put it in, cook it, and it's done, right? But sometimes you have to stand at the stove and stir the pot. Sometimes you have to enjoy the movement, correct? So, when it's so
So
many
being
ways.
the movement queen, yes, you gotta
Yeah.
enjoy the movement.
Right? It's simple as what we do, what you do in your practice, what I do in my practice. I'm always saying we treat gracefully. I could I could definitely, do a song and dance for a patient and take the pain away. But the pain would come back. And so, what good of a practitioner am I allowing that to happen? I'm not going to be a band-aid. I'm not going to be covering up something. I want to make sure that we fix it or we reroute it and we take care of it. And the patches do that. They take care of it. And but there's so much behind the patch, so much. It's kind of mind blowing. Wearable wellness is mind blowing, right? But I think that's what our technology is going to. Our life is going to, right? Who knew years ago would have AI?
Oh my gosh. So Kym, tell me something. All right. So for people that are completely like, what is this patch? What are you even talking about?
Right.
Can you just give a quick, here's the technology, here's what it's doing, and maybe we'll give a few examples of some of the different ones that people have.
So this patch, it's a 3M patch. So it's medical grade tape. On it has little ridges like a QR code or like a thumbprint or like Braille. And they're tiny patterns on the patch that are engineered to send very specific vibrations through your skin when you wear it to the brain. So the patch itself doesn't vibrate like your phone, but it activates naturally through your body's movement or pressure. So, which is really, we could go off on a tangent about battlefield acupuncture that, you put in these certain needles for battlefield acupuncture in the ear. And it's the movement of the person during treatment that you walk them to and from that activates those needles in the ear, which is kind of like this. So when you stick it on your skin and choose the point or choose the area, and we can talk about that, your nervous system picks up these patterns and then it through the skin. So those signals go up to the brain, which processes them and sends little messages to the rest of your body saying, depending on the patch, and we'll go through that, you will or I will better balance and stability or improve focus or energy or reduce stress or reduce pain. And think of it like a shortcut for your nervous system. You don't have to take a pill. You don't have to plug in anything or turn anything on. This patch just uses the way your skin and brain naturally works together. It's a drug-free, non-invasive, and based on neuroscience and touch.
Beautiful. So you put it on, and it's almost kind of like, if people are still like, I still don't get it, here's a really, I think, just a great thing. So if you put your hand on a hot stove instantly, the brain knows, take it off, it's hot. Well, how does that happen? Because there are, sensitivities on the skin that is really noticing what's going on in the environment, sending those signals through the skin, and it's called the ion channels to the brain. So the brain can go either, yikes, take it off, or I want more of this, or whatever it is. That's how, through our skin, which is the barrier between the inside and our environment, that's how the brain knows, and how we know, is it cold, is it hot, is it what's happening out here? And before we started, I was saying to Kym, I have a theory that I'm just going to put out, and then we'll continue through, because I am absolutely fascinated with the whole idea of our fascial system, which we now know is the largest organ in the body, covering absolutely everything. And it is the communication system through the body. But I also believe that it also is sensing outside the body and into our body field, which is also one of the reasons that a lot of our energy frequency kinds of things, like, I do the AO scan and other things, absolutely still work. It's working on the body field, felt by the fascia, and then into the body, and shifting things physically. So regardless of how it's working, it's sensing what's happening and sending communication to the brain. And I know one of the things that Jay, who is the inventor of this, he calls it, at least one of them, it's sort of like, we call it the foundation patch, the Liberty patch. It's just giving you a neurological nervous system upgrade.
Right.
It's balancing the neurology so that everything else works so much better. So you want to share a little bit more about the individual patches and how they're working?
Sure. If I forget one, you can chime in. Well, there's the freedom patch, and that's the pain patch. That is, it says, on the packaging, it says deal with pain like never before. I think that's what it says. Yep, that's what it says. And I really know these patches. I'm serious. I love this whole thing. And then I really love the joy patch. That is hope and happiness like never before. So that patch actually works with your emotions, obviously, and just calms you, but also gives you feelings of uplifting. And so when you're down or uplift, I have a acupuncturist that puts joy on one arm and peace on the other one. There's another one called peace. And she says it is a complete, there's an acupuncture point called Ren 17, and it's right here in your chest. It's a beautiful point. It actually has a motion like, treat me, give me this treatment. I open, my healing to you. That's what that point really, speaks to me like that. But it was really great. She put joy here and peace here, and then see that alignment. So she aligns her patient before the treatment.
Beautiful.
How beautiful.
So puts it on her patients before treatment. That's so brilliant.
Yeah. And so again, less is more, less needles used, less needles needed. So we got joy, and we got sleep patch for sleep and for very good REM sleep. And a lot of people put that on specific areas. Some people put it on the bottom of their feet at night. That's a great area. And for the practitioners out there, that's the kidney organ, kidney 1, and it really does do a lot for your life force and, taking you back to being calm. And then I don't even have them out in front of me because I don't have room enough on this table.
It doesn't
So there's
matter.
the Liberty patch that's known for balancing. Specifically, we had a friend that could not bend over and put a golf ball on a tee without stumbling. He was older and had neuropathy. And that's one of my great discoveries of these patches, because we were patching people we knew. He was able to bend over and put that golf ball on his tee. And then he wasn't embarrassed. He was always having someone else put that golf ball on the tee. And he didn't have to do that anymore.
And here's what's really fascinating, I find, about, I'm going to just specifically say the Liberty patch, because that was really the one. The thing that I just love about the Liberty patch is when you put it on, you don't necessarily feel anything. Understand that with the patches, I think sometimes people are still thinking like Western medicine. I have a headache, I take an aspirin, 5 minutes later, I feel better. And yes, like with the Freedom patch, that can happen. But with something like the Liberty patch, it's giving you stability. It's giving you a sense of balance. But it's so subtle that it's not like you put it on and right away you feel differently. Yeah. And so that's why I love that we have what we call the balance test. And one of the ones that just blew me away was when I was working with my brain injured man, because, he doesn't have any preconceived notion. He was fallen that day. He didn't have good balance, and we did it. And he fell into my wall, and we put that balance, and he was strong. And then I loved it because the look on his face was he was so excited. Right. But he did, because you put it on and it's oh, Renee, what are you doing? We don't what. So it's not like you feel differently, but when you do the test, you recognize, oh, wow, like now I'm stable, right?
Right.
It gives you that mental idea of, okay, this really is working. Like you can't fake that. You can
Right.
feel it
Right.
then when it's being tested.
Right. Right. Exactly. And that happens time and time again. And you have a great video on that. And there's
Yeah.
of that person. And even specifically, I have someone I know that did it on her. I think he's 10, and he was like, "Whoa!" I mean, he couldn't believe it. He was 10 years old. He's not faking it.
Right.
And then he was able to do it to her
Oh,
and
that's
his mom. And it was. I wish I had a video of that. That would have been a really good video. And
fun.
he, when all doubt, when you have doubt, you go to a child or go to an animal, you know?
And and go to an animal because they work on that too. And we see so many videos of kids
Yes.
getting such a great benefit, and then coming back and them asking their parents, "I need that patch. I want the focus patch. I want the peace patch." It just calms them
Right.
down because
Right.
they feel it. They see and feel the difference, whereas
Yes.
we're not quite as tuned in to our
Exactly.
environment and what we're feeling on the inside.
Exactly. Exactly. They know my grandson, but just he texted me. I had sent him peace. And he's in college and he was getting, all hyper about his classes and about what was due when and, this and that. And he acknowledged it to me, which he had never acknowledged that that's how he can't focus because he's afraid that something's not going to get done. So anyway, he got the peace patch, put it on, and he says, that I put it on my forearm and I don't think this is the place for it. And I go, oh, okay. And I said, where do you think? He says, well, my tricep area. And I said, okay. And he texts me, and I have the text. It says, wow, I never expected these patches that you're pushing
It's a
to do such a wonderful job. And that's exactly what he said.
wow.
So that is another proven, I mean, that's just a 21-year-old that could feel these patches. And
All
there's
right.
many.
But that brings us to another point. Okay. And here's what I would love some of your information about, like what you're, because not knowing Kym, the one thing I can say is Kym is she's very intuitive. So with a lot of these patches, she can just sense a person and what works and where it should go. But for the rest of us, who's like, okay, here's a patch, what do I do with it? Right. The understanding is, does it matter where we put it? Because the company is like, put the patch on wherever it'll stay, where you don't have ski, right? And I found certain places wouldn't stay on me at
Right.
all.
Right.
And I'm like, okay, but why is that skin different than that skin? And what I sort of feel is, for me, this is just for me, when I put them on the top of my feet and put my socks on, they stay really well. Now, I think that's just my body, not just the skin. So just share with me the placement, your idea of placement.
Well, my idea of placement, and we're working on this as a group, as a practitioner group that I have, and in my team. Um, my idea is to look at the acupuncture points. Patches. There's a popular patch that does do that, and very simply. But so you look at where you would like that, where you would put an acupuncture needle for what you're trying to do with your patient, and you look at channel. We talk in meridians and channels, and we look at channel theory. Now I can place it on a patient right away. I look at, okay, is this acupuncture point going to be a good stable area for this patch? And then I would choose that area, opposed to maybe an acupuncture point area that the patch might not stay on well enough, because the patches stay on 24 hours. They must come off in 24 hours. And there's a reason. They come off slowly. They don't get ripped off like a Band-Aid. They come off slowly. Because think about it. Would you rip a wire that was going to your brain? Would you go and unplug like this? You wouldn't.
Very
So you
interesting.
have to take it off slowly. And they only stay on for that amount of time because the tape is still a medical tape, yes, but it doesn't have any kind of preservatives or any kind of see. So in medical tape law, you would definitely want to take off that tape if it was on a patient after surgery, right, and change out the tape. That's what they want to follow. So that's good to know.
That is good to know.
Yeah, but in within, we have channels going through our bodies and meridians going through our bodies, and so we choose channel theory. Like if we needed an energy point or immune point, let's do immune. So there's a patch called Defend, and it's for the immune function of the body. It is a one that can enhance inflammation, not enhance inflammation, but anti-inflammation in the body. And we would put that patch on maybe an acupuncture point that we call stomach 36, which is on the leg and right below the knee, or below the belly button. So there's different acupuncture points for the immune function of the body. And so we would choose
because that's typically where I put it. I just where
really
I
on your
every day.
Yeah. So anyway, we have other patches. Let me just go through them and just say a little snippet for each one of them. So we've gone through the Liberty, we've gone through the Freedom, the Lumi patch. So that's for skin, but also I've used it for lung health because we're looking at the tissue of the lung. So then the REM, which is sleep, and the Boost, which is for energy, and it has no caffeine, no sugar. So why not have a Boost patch, right? And then there's the Defend that we were just speaking about. There's one Rocket patch, and that definitely is very specific to age. So how you use, how many days you use it based on your age, which is very interesting. And it also.
And what's it for, Rocket?
Right.
It's mostly used for men.
Right.
We'll just say
yes.
that way.
Yes.
Okay,
well, I can say it's mostly used for erectile dysfunction.
Very good.
So that is, under 40, you're using it for more days than if you are 40 to 50. It's 2 days. It's like anything, but it's very interesting how it does that. And then there's a Joy patch, which I spoke about, which naturally fills joy and happiness. Ignite. It is enhanced resting metabolic rate, which is, that's interesting too, right? So it's a way, it burns more calories at rest and reduces your cravings. And a lot of times people put it with Kick It, which helps overcome bad habits and fight cravings. But it can also be used with neurodivergent children. We can do that. There's the Peace patch, which puts you at rest and manages and reduces stress. And there's the Focus patch. That's a good patch. I've used that many times, especially when I was trying to get a book to an editor. And so it enhanced focus and attention and clarity and enhanced memory. So that's really important as we age. We want more memory, right? We want to remember things. So that's a great patch. But the Victory, you and I both love Victory. And so it's enhanced athletic performance. It does more power, more strength, enhanced stamina, more agility, more balance, reduces inflammation though. So it is definitely for an athlete, but I think it's beyond that also. And it has faster recovery, enhanced neuropathy relief. That's a very important component because there's a lot of people that have neuropathy out there. So there's our
And
patch.
it helps with my endurance. So like if I'm going for a hike, I can really hike up and just not get tired. I can go for longer and the recovery is much quicker.
Mm-hmm.
So I actually personally prefer the victory over the liberty, but everybody's a little different and it's good to kind of try these. Kym, before we end, there's one question that I get a lot. So I'd love your answer to this. Over time, let's say that you're trying to help with something specific, focus. We'll just use focus. Do I have to wear these forever?
Very interesting. Well, if you were a patient of mine, I would say when your physician puts you on blood pressure meds, do you take it forever? And usually that happens. You don't have to wear the patch forever. I think it self-corrects sometimes. That is my opinion. I'm not saying it's the company's opinion at all. That's just my opinion. I think that cells have memory. I know that cells have memories.
Mm-hmm.
And I think that the wiring can be fixed. I also think it's like something that you should have in your toolbox that you can always use on your family for yourself. If I sent a couple to one practitioner, and she said she smashed her finger, and these had come in the mail, and she put the Freedom, the pain relief. She said, oh, "Holy cow! My pain stopped." And she says, "I'm sold. I'm doing this with my patients." I mean, just flat out, that's it. And so they work. Let's just say a medication sometimes will work at different levels, different milligrams, different types. There's many different blood pressure meds, and I just use that because it's common. And sometimes you have to play with it. And it's the same thing with the patches. Sometimes you have to play with it. People have different little prescriptions of patches sometimes. They put this one on, this one on.
It's like a cocktail.
Yeah, exactly.
Cocktail, which things work and which don't, and sometimes it can be difference with the days. But the good news is there's no negative side effects. There's no ingredients. If you don't like a feeling, which I haven't had anybody, but if you don't, just take it off. It's not like a drug that's now in your body and has a half-life of 3 days. No, you just take it off, right?
Right.
My thought about it, Kym, and I don't know if this is true or not, I'm just throwing my thing out. I can see where over time, depending on what it is you're looking to shift, that your brain will start to rebuild different neural pathways to correct. So I can see where maybe over time you might not need to wear something all the time, but then you have it. So let's say, okay, I didn't wear it and I'm still feeling pretty good. Maybe 2 months later, it's like I'm starting to notice some of these feelings coming back. Then put it back on. It can't hurt. So as you said, it's just a great thing to have in your toolbox.
Exactly. And you don't have to, let's just say real quickly, let's say weight loss.
Everybody wants to lose weight.
Everybody wants to lose weight. So you say, okay, this Ignite works for weight loss, but the kick it would be the habit. Okay.
Right.
So let's say, I don't want to wear 2 patches, or economically I can only afford so much. You could kick it one day and Ignite the next day. And, so you'd go back and forth. And I think that works also. So you can design and create this, this is your wellness. This is specific to the individual. And we can design and work with that. And we're hoping that we can spread the word through the practitioners of natural health, wellness, and convince some other docs about these. We have a great advisory board, and they are MDs and natural health practitioners. So, it's not like we're, like this is all woo-woo. This is real stuff,
Right. And this is science-based, even though it looks woo, it's not.
Right. And there's studies,
Excuse me.
and there's many, many studies. So,
Love it. Well, Kym, thank you so much for coming on and
you're very welcome.
sharing about the patches. I have a feeling we're going to be doing this a lot because there's just a lot going on with them and just so much to learn. It's just so exciting, the stuff that's coming out now. And I just love it, love it, love it. There's, we can take control of our own health in so many ways. So if you're somebody that's feeling like there's no hope, there is hope. There is always hope. Do not give up, and just touch base with either Kym or myself if this is of interest to you, and we would love, love, love to share more. So Kym, once again, thank you so much for coming on, and you know what? We will see you guys soon.
Have a great day.
Thank you for joining me today on the Body Harmonics Podcast. I hope this conversation sparked something inside of you, a reminder to slow down, breathe deeply, and come back home to your body. And if you enjoyed this episode, please be sure to follow, subscribe, and leave a review. It's the best way to help us share this message and keep these heart-centered conversations going. And if you're eager and ready to go deeper, connect with me on social media at Body Harmonics, or head over to our website for free resources, upcoming retreats, and ways to move, heal, and flow together. And until next time, remember, move freely, feel deeply, and flow.